and good evening, or I think this evening. It is. Let me get these other cameras set up. One moment. We are doing. Okay, so we got those. So, good evening. It is Tuesday again, and we are here to do Ask Just the MP. Know your numbers. So, today's focus is going to be the men's health and hypertension in particular for our African American men, especially. Um, so, most of the time, I'm talking to women, so we are gearing this towards talking to our women that support our men. So if you have your man home, please bring them in the room and y'all watch this together. Or um, you can watch it and relay the information. Okay. Also, just to do a little housekeeping, you can follow me also on Facebook at either ARS Medical Primary Care or I am Jessica Brooks. Um, Here on YouTube as well. Make sure you follow because I do these videos every week. In the hopes of eventually turning this into a live. So the more people I can get, then maybe we can do live where I can answer your questions in real time. Okay. I'll still provide the educational questions, but and for educational conditions. But I do want to talk to y'all in like real time. All right. So let's get started because this week is jam packed with information. So you will see as the slides go on how much information we have about our men's health related to hypertension. And if you have any questions, as I always state, or any comments, please comment them below in the comment section. And either I can make a video if it seems like a question that more than one person may be asking or want to know more about a certain condition. You can also list a certain condition, and I can see about making the video for the next week and related to that. Um, okay, so let's get started. So we're talking hypertension, and yes, I will be kind of reading from the slides, and I'll add in information as it comes to my mind if there's something else that I wanted to add. Hypertension in African American men is caused by a complex mix of biological, social, environmental, and lifestyle factors. So it's not just what we eat. It is a lot of things, or just what men eat, and so there's a lot of things. It often starts earlier in African American men, and it's more severe compared to other groups. Here's a breakdown of some of the common causes: genetics and salt sensitivity. This is one thing that I see a lot of us African Americans, we don't fully understand why there's a difference between the Caucasian counterparts and African Americans when we talk about how much salt you should be taking in. Um, as African Americans, it has been studied that we do have an increased salt sensitivity. Um, it means that the salt raises the blood pressure more than other groups, so we need to take that in severe consideration in today's time with how much sodium is present in these foods or food like product foods or whatever you want to call them. Certain genes may influence how the body retains sodium and manages stress hormones like renin and angiotensin. Um, Diet and nutrition: high sodium intake from processed foods, fast foods, and takeout. Low intake of potassium, calcium, and magnesium, which is found in fruits, vegetables, and whole grains. High cholesterol and saturated fat intake also contribute to cardiovascular strain. Sedentary lifestyle: low levels of physical activity due to work demands, neighborhood safety concerns, or lack of access to recreational spaces. Sedentary behavior increases weight gain and stiffens arteries. Um, Obesity and overweight: excess body weight puts more strain on the heart and blood vessels. abdominal fat in particular, which was what we call a visceral fat, so the fat that's around organs, has been linked to insulin resistance. So that's why you see a lot of time you may see a lot of people with diabetes and high blood pressure, especially African Americans, especially African American men. They will sometimes go hand in hand due to insulin resistance, inflammation, both linked to hypertension, among other things. Chronic stress and racism. Daily exposure to racism and discrimination creates chronic stress, which raises cortisol levels and blood pressure over time. Stress from finances, relationships, work, and being a black man in America can lead to emotional and physical exhaustion. So we need, as women, we need to check on our men on a regular basis. Just ask them personally, not meaning they're if they have a cold or if they feel bad. How are you doing, right? Because they go out here in the world every day and have to deal with these stressors of life of just being an African American man, and they have become so accustomed to dealing with it, they have adapted to it to where they think they are, they're walking around, everything is fine, but not realizing that the everyday stresses is what is contributing to the fact that they're having these overweight and being and having high blood pressure, which places black people or African American black Americans at a higher risk for stroke, as you'll see later in the PowerPoint presentation. Some of the, let's see, we talked about physical exhaustion, mental health and coping. Unaddressed depression, anxiety, and trauma can increase hypertension risk. Some may cope with stress by smoking, drinking, or overeating, all of which can worsen blood pressure. Smoking, alcohol, and drug use. Tobacco use narrows the arteries, so they make them smaller, and raises the blood pressure because it's just like a water hose. If the space is smaller, the pressure that has to go through to still move that same amount of fluid through that hose puts more pressure, which means that pressure is higher. So that's the same concept with high blood pressure. Excess alcohol, especially binge drinking, is linked to spikes in blood pressure. Substance use can worsen heart and kidney function which both contribute to increased blood pressure. Limited access to care and prevention. Delayed diagnosis due to lack of regular checkups or distrust in the healthcare system. We understand. We understand the history of black Americans and healthcare. And I'm saying this as a healthcare provider. At some point, we have to use that information and be aware of the history. Don't erase it, but be aware of it. But at the same time, we have to live in today's time, and we need to do something about our health. And the use of the healthcare system when necessary is very important. So that's why people like myself have intervened and become healthcare providers to be that representation for our people. Yes, we still have the same education as the other counterparts, but we can culturally tailor that education to black Americans. And that's what I try to focus my practice on. So we have to build some trust so that our health can be better than what it's been, because our numbers are extremely high for early deaths or disability related to things that are preventable. And that's why primary care is so important. The use of emergency rooms is not what hospitals are not used for primary care. They're not designed for primary care. They are there to stabilize you and get you back out so you can then go to primary care. But if you go to your primary care ahead of time and on a regular basis, then you should be able to prevent these hospital visits for things that can be managed in primary care. Okay? So, delayed diagnosis due to lack of regular checkups and distrust in the healthcare system. Under treatment or lack of follow up for those who are diagnosed. This is where I see this a lot, because I also do DOT physicals at my office. And so, our Black American men come in, and of course, we understand you have to work. Of course, we understand that you working in transportation and earning a living for yourself and your family is very important to you. But it needs to be as much important to take care of your health appropriately, so that when you come in for your DOT physicals, you are not so anxious about your blood pressure, because you should know that it's under control. It shouldn't be something that causes you anxiety because you are unsure, because you know that you've been doing the things that cause high blood pressure. You've already been diagnosed with high blood pressure and you're not properly managing it. So therefore, one moment. So therefore, the blood pressure is then unmanaged properly, because you're not doing your follow-ups after being placed on blood pressure medicine, and you're not doing the things that have been recommended to do to help decrease the blood pressure. We have to do better. We have to work together, as healthcare providers and as patients. We have to work together to combat these illnesses. Um, Few culturally competent providers and limited community-based prevention programs. Right. And this is why like I said before, this is one of the reasons that I decided to become a nurse practitioner and to open my own practice in communities that have a higher rate of, or a higher population of Black Americans. So it's not just personal choices, it's the full picture. So that's why there's so many reasons that can contribute to a high blood pressure. Hypertension in African American or Black American men is shaped by genetic, systemic inequality, stress, lifestyle, and access. It's not just the diet that you're eating, but it's a major factor in our choices. But there's many more layers to what is causing the high blood pressure that we see in Black American men. Okay. So the stages of hypertension explain. When I say hypertension, also mean it's the same thing as in high blood pressure. So understanding blood pressure levels is crucial. So being educated about blood pressure levels is crucial for managing hypertension, because if you don't know what you're looking at when you're taking your blood pressure, if you're not knowledgeable about the criteria, not as a healthcare professional but as a person, you should be able to, if you have high blood pressure, or if you know someone that has high blood pressure, you should be able to look at a blood pressure reading and say this is too high or this is too low. Okay. So the knowledge of this empowers you to take proactive steps towards better cardiovascular, which is like your heart and your blood vessel system, and overall well-being. So to keep it simple, the American Heart Association in 2024 has kind of tweaked the blood pressure guidelines to make it a little bit easier to, because there were all kind of stages and all of these things that we were using as healthcare providers for blood pressure. So now we're looking at non-elevated is less than 120/70. So if you take your blood pressure and that reading is, the numbers are less than 120 on the top number and less than 70 on the bottom number, that means that it is fine and there's no treatment advised. If the number on the top is between 120 and 139 and on the bottom between 70 and 89, then treatment may be advised based on your cardiovascular risk. So this means that you need to follow up with your primary care, not the hospital, your primary care provider with these numbers and see what their recommendations are. Okay? So they may recommend things like, okay, start off with changing your diet, going through what are you eating, you're changing your diet, your exercise, and see if that helps to decrease the numbers. If that does not work, then maybe a medication may be started, right? But the best treatment is to stop doing the things that are causing the blood pressure if possible, the high blood pressure if possible. And then you go into hypertension or high blood pressure. Once the blood pressure readings are greater than 140 on the top or greater than 90 on the bottom, or equal to one, greater than or equal to 140 on the top and greater than or equal to on than 90 on the bottom. So then this would need to be confirmed with your primary care, and then start treatment is the recommendation. Okay. So the main takeaway here is to be able to take your blood pressure yourself at home on a regular basis. So having a blood pressure monitor, which you can get at almost any store nowadays. You can get them at Walmart. You can get them at the local pharmacy departments. They don't cost that much. There are different ranges for different ones. But have a blood pressure monitor in your home, because that's the best measurement of your blood pressure when you're in an environment that you are relaxed. And then these need to be confirmed as well in your primary care. So you need to, if you do not have one assigned to you or one that you have picked out, you can, two things. You can find your local one that's local to you, and see if you have insurance, if they accept your insurance. That means if they are in network with your insurance, or if they have a self-pay option to where you could have primary care services with them and pay yourself. Okay. And I will do a shameless plug at ARS Medical Primary Care. We are located in North Carolina, and we do have both. We do accept Medicaid, Medicare, United Health, Blue Cross Blue Shield, Aetna, and Better, um, Alliance, which is under Medicaid, and we do have self-pay options, which are very reasonable, where you can do telehealth or you can do in person. Okay, so reach out to us. Our website is arsmedicalplc.com, where you can book a telehealth or in-person visit, and we can definitely get you on the right track to managing your blood pressure better. Okay. All right. So there's a few things going on this slide. Diet and exercise. Managing hypertension through diet and exercise is crucial to the overall health and well-being. So I focus a lot on diet and exercise because these are two things, well, especially diet, things that you have to do for survival, right? So you want to make sure that the choices that you are making, as we saw in the previous slide, is not completely about our choices. There's other factors, but when we are looking at the things that we can modify, things that we can change, diet is one of the main things. How we eat and what we eat. So healthy foods, incorporating fruits and vegetables, as we all know, standard things, can lower your blood pressure effectively. Regular exercise and engaging in physical activity helps maintain a healthy weight and reduce hypertension. As we stated before, being overweight or obese is one of the factors that can cause high blood pressure. Staying hydrated, drinking plenty of water, it supports vascular health, keeps that blood a lot thinner, and helps it to move smoother through the blood vessels, which doesn't put as much pressure on the blood vessels as they and reduces the strain on the heart. Balanced diet, eating a diet rich in whole grains and significantly improve cardiovascular health and blood pressure. More fiber helps to decrease blood pressure as well. Now, limit sodium was an area that I really wanted to focus on. That's why there's a lot more information here, because I am talking specifically to our Black Americans, and especially in this month, we're talking directly to our men, but this applies to all Black Americans. So reducing salt intake is vital for controlling blood pressure levels. higher rates of salt sensitivity. Like African Americans, on average, are more salt sensitive, meaning their blood pressure is more likely to raise with higher sodium intake. This sensitivity can be genetic, affecting how the kidneys handle sodium, leading to fluid retention and increased blood pressure. Blood, better blood pressure response to sodium reduction. Research has shown that Black Americans or African Americans see greater improvements in blood pressure when sodium is reduced compared to other groups. The American Heart Association recommends less than 1,500 milligrams of sodium per day for African Americans or Black Americans and others at high risk. This that's just a little over half a teaspoon of salt. How much sodium is in the average fast food meal was a question that I had. So the average sodium per fast food meal is 1,200 to 2,500 milligrams. So we said that you need less than 1,500 milligrams. So if the average is putting you at one meal is putting you at close to or over that, that means that you can't eat that multiple times a day, right? So that's almost more than the entire daily limit for sodium, especially if you're African American or Black American or have hypertension. So when we say we need to watch our the food that we eat, we need to watch the food that we eat. We need to stop eating so much fast food, which is contributing to this high blood pressure among other illnesses. Okay? I'm not perfect. I eat fast food too, but we need to not eat it as much, right? All right. Treatment options for hypertension. Exploring alternative therapies and pharmacologic approaches can effectively manage hypertension for better health outcomes. Alternative treatments, holistic methods like yoga, meditation, which I know yoga is, we like to say that's not our thing, but meditation, taking a moment, that can be anything. Just taking a moment to relax yourself. Sit, close your eyes, relax, and just get yourself together. That can in itself, I'm trying to see how much time has went by. This is getting a little long. I don't know. I may have to cut this into sections. We'll see. Can help decrease the blood pressure. Pharmacologic approaches and medications prescribed based on individual needs. Individual is the key. One size does not fit all for medication. That's why there's so many types of medications. Needs effectively lower blood pressure. I see people complain a lot about, oh, they think that it's bad practice when your medication has to be changed. If they give you a medication, they get to know you a little bit and they start you on a medication, and then that medication may not be working. Well, different medications, as you'll see in the later slides, work different ways. And so, and there's, as we saw previously, there's different things that cause high blood pressure. Well, we don't have a magic ball to go in the inside and say, hey, this is exactly the thing that's causing your blood pressure. It could be a multiple of things. And so that's why we change medication. We start you on a regimen that we think may be based on the things that we see, based on your labs, based on signs and symptoms that may be causing the blood pressure to be up. And if those things, if it doesn't get it to the lower numbers that are recommended, then we make changes. That's basically how medicine works. There's no one size fits all. In that case, there would only be one medication for every condition, right? Some common medications. Certain drugs work better for African Americans based on genetic factors affecting metabolism. Okay. Medications. Understanding medications can significantly improve health outcomes for Black American men with hypertension. So we should be able to, as patients, as healthcare providers, we should be able to educate you on why these medications, why you need the medications, what they should be doing, and things to look out for, because we can't be with you 24/7. If we could, there may be better outcomes to health conditions, right? If we could be in your pocket saying, hey, don't do this or don't do that, you would probably get tired of us after a while. But that would solve some of these problems. So, efficacy: certain medications have been shown to be particularly effective in managing hypertension in Black Americans. Side effects vary by medication and can impact adherence to treatment. So, sometimes we see, oh, this medication made me feel this way or that way, so I stopped taking it. Well, instead, you should have reached out to your primary care provider, told them what was going on so they can see if this is a side effect that's related to the amount of medication or the milligrams that could have been decreased, if they can be, or if it's related to, there needs to be a change to a different medication based on the side effects. So, reaching out to your primary care provider is the first step if you're having a side effect, but you should already know what side effects to look out for when you start the medication, because your primary care provider should be educating you on those side effects to look out for. Mechanism: understanding how medications work helps to manage expectations and improve compliance. This is a key that you should understand. You do not have to understand it on the level of a healthcare provider, but you should understand it on the healthcare of on a standard of being a patient that is taking a medication. You shouldn't be taking anything if you don't know how it works and what it's supposed to do for you, the expectations. Racial differences. Racial differences can affect both drug response and the incidence of side effects, as I stated before. Treatment options. Various treatment options are available, including both pharmacologic and lifestyle interventions. Okay. The next page I think is pretty packed. Are kind of small. I'm going to just do a quick sum. You can pause the video or go back and stop it, and if you wanted to look particularly for the types of medications that you are on. So you have thiazide diuretics, which most people would call water pills. They are diuretic. Basically, they help the body get rid of extra salt and water. Water follows salt, so if we can decrease that salt follows water. I'm sorry. If we can decrease the water by giving you a diuretic, which makes you pee, that's getting rid of the water. That salt will follow out of the body and help to lower the blood pressure. That's basically how those medications, which a lot of people are on, like HCTZ or chlorthalidone. I'm sorry, I'm tongue twisted today. So removing that water helps remove the salt, helps the blood pressure go down, right? Okay, they can be very effective in Black Americans due to their mechanism, which doesn't rely on the what we call RAS system. Okay. Oh, this is calcium channel blockers. Calcium channel blockers like amlodipine, nifedipine, NNPINE. These are some medications that, like I just stated, they can be very effective in African Americans. Then you have diltiazem, which a lot of times is used for heart rate control. Basically, what they do, they relax the blood vessels. So if they're tight, they're stiff, it relaxes them, and it allows them to not be as stiff, and it decreases the workload on the heart when it's pushing the blood through those blood vessels, which helps the blood pressure go down, which I stated before. And if you have a water hose that is narrow or tight or hard to get through, and you're pushing the same amount of water through there, the pressure is going to be higher than if it's relaxed and open, and that can move smoothly through there. So that's the effect of calcium channel blockers. We have ACE inhibitors, not always used in African Americans as a first choice. So we'll kind of skip over that, but you can read that for yourself. If you're taking any of those medications, there's nothing wrong with them. Just make sure that the key point that I want to put here is to make sure that if you started one of these medications like lisinopril or enalapril or ramipril, and it's been like a week after you started and you start having a dry cough, it may be related to that medication. Talk to your primary care provider and they may switch you to another medication. It's a side effect that's common with these medications, but it does have a higher risk of angioedema, which is a rare condition. You may see people putting pictures of it online, but It's not really that common. Um, let's see. We have ARBs like losartan, valsartan, olmesartan. They're used when patients can't tolerate ACE inhibitors. So, like I stated before, if you're taking a medication that's an ACE inhibitor, like those lisinopril, enalapril, ramipril, you get that cough, they may switch you to an ARB, which is a losartan, valsartan, olmesartan, due to that cough or angioedema. If you have either of those side effects, they may switch you to an ARB. Also helpful in protection of the kidneys, especially if someone has diabetes. So this is a good category to use if you are diagnosed with diabetes and high blood pressure and you're African American, then an ARB is a good medication to use. So it may be combinations. So sometimes you're on more than one medication for blood pressure control. So common combinations you may see: amlodipine, which is your calcium channel blocker, which relaxes those blood vessels, and a diuretic, which helps to remove that water, which removes that salt. An ACE or an ARB, and the fluid pill, right? Um, you may see other classes, but they have different effects. Beta blockers. If they have heart disease or you've had a heart attack, you may be on this medication as well. Aldosterone antagonists like spironolactone for resistance. So if their blood pressure just give a hard time to change the medications, we've done all these things, they may add a spironolactone for resistant hypertension. There are a few others here that you can read, okay? And so just know why you are taking. That's the main takeaway for this. Know why and what they're supposed to do for you to help decrease your blood pressure. Stroke statistics. I don't have a whole lot because this PowerPoint is really geared for the Black American man. So there's not a whole lot, and I'm still looking for a little bit more data. If I find it, I will put data related to these statistics on like Facebook posts or something like that. So 2025 projections indicate increased stroke incidences nationwide. Overall, U.S. stroke rate is expected to double by 2050 as part of a broader cardiovascular and stroke projections driven largely by hypertension and obesity. Okay? We're in 2025. That's only 25 years from now. And they're saying that this is supposed to double. Already see so many instances of this, and now it's supposed to double based on largely by high blood pressure and obesity. We are, as a nation, we are bigger than we've ever been. And it looks like we're only going to get bigger if we don't make changes. The health impact: stroke continues to be a leading cause of disability in America. Awareness efforts: increased campaigns aim to reduce stroke risk factors significantly, and information like this from ARS Medical Primary Care helps to bring awareness and information about what we are trying to do to help prevent these complications. Okay. It said in 2020, approximately 795,000 strokes occurred um, in the U.S. each year. That was kind of like the impact um, of this. And I guess so now we're looking at 2025. There may be a decline by 10%, hopefully more than that, but just with the the campaigns and awareness and more education and people actually using that information for their good, we may see some decline in strokes. All right, so I'm going to get off of here. I have taken a whole lot of y'all time. I have given you a lot of information, things to use, things to um, take into consideration, but take action, right? Take action is the main thing. Know your information, know your medications, know what to do, and create a plan. If you are looking at trying to figure out an individual plan, you can contact us at ARS Medical Primary Care. We are located and licensed in North Carolina currently. Is the only state that we are licensed in. Our phone number is 704-595-3742. Email is listed and website that where you can book an appointment, telehealth or in person. Please reach out to us if you are looking for your individual care to be better managed, especially with high blood pressure. And we do all primary care conditions, but high blood pressure I think is going to be one of our main focuses. We are currently creating an actual program to where we can work one on one with individuals in North Carolina to either better manage their blood pressure or help or get to a point to where we can decrease some of the blood pressure medications, if not all, is our goal. So be on the lookout. Make sure that you follow us on Facebook. And also, a main thing you can do is go to our website, arsmedicalplc.com, and subscribe to our email list on the pop up. That way, you can get first notifications of when this program launches, and which will give you first dibs on entry. Because I think with the light of what is going on in healthcare, I think the program will fill up pretty fast. But it will be a first come first serve, and the people that are on the email list will be the first ones notified, which gives them the first dibs on getting enrolled in the program. All right, so I've taken much of your time and I won't take any more today. This is our Tuesday Ask Just the MP condition explanation. And I thank you very much for watching. Pass this information on to someone else that may need it as well. And ladies, make sure we take care of our black men. Make sure they stay safe, they're healthy. Check in on them and take care.